Are you concerned about your health care with the passage of the big, beautiful bill? Hey, I'm Tommy at MedicalInsuranceToday.com. Been getting a lot of questions about this in the last week since the passage of the new law, and things are going to change. So I want to touch on some bullet points here, specifically to Medicaid, which is nationwide Medicaid. In California, it's known as Medi-Cal. In California, Medi-Cal is set that based upon your income, you qualify. If your income is below a certain threshold, you qualify for zero-cost health care, and it's comprehensive health care at that level. Now, what's happening in the passage of the big, beautiful bill and what you're hearing in the news with the cuts to Medicaid, what is in fact happening is folks that are not lawfully present. So if you are here and don't have a green card, don't have a work permit, don't have a visa, you're a non-citizen, currently in today's healthcare climate, you currently qualify for what's known as emergency Medi-Cal. So your only access point to healthcare is through the emergency room if you're not lawfully present. Now, that still gives them access, gives non-lawfully present folks access to healthcare, but it doesn't cover doctors and prescriptions and outpatient stuff. It's all through the ER. Now, that's going to change. That's going to go away, unfortunately. So that's a big step and a big bullet point to consider. Next is the verification process for qualifying for Medi-Cal. My understanding is that there's going to be probably 2 verifications annually, that you're going to have to provide a pay stub and a W-2 to prove that you qualify for Medi-Cal, which is a big loophole. I see folks that qualify into Medi-Cal all the time that make way too much money, so I can testify to that. I see that on a daily basis, in fact. That's going to change. You're going to have to prove that you qualify for it and that your income is in fact below this threshold to get onto Medi-Cal. Next is work requirements. This is a real gray area. Is they're going to verify if you're an able-bodied person and you are not working. There's a chance that folks could lose their Medi-Cal. That's a rather gray area. And lastly is the DACA, the Deferred Action, or also known as the Dreamers, we call them in California. So these are folks that were born here in the States of non-lawful present immigrants. And if you are born here and do not have lawful presence, my understanding is that the health care is going to go away for those folks that are not lawfully present and were born of non-citizens. So there's the major bullet points to touch on. If you have questions about this, confused, concerned, and need answers, we are not the government. I always like to tell people, I'm here to help you figure out your health care. Please reach out to us. We can answer all these questions for you. As of right now, nothing formally has changed. It's all going to start rolling into the system in 2026. But please reach out to us, MedicalInsuranceToday.com in Costa Mesa, California, and we look forward to serving you.